This is Mon Health Talk, a weekly program focusing on the dedicated physicians, nurses, and staff at Mon Health, the region's premier community hospital system. People with skillful hands and bright minds using state-of-the-art technology. We don't just practice medicine, we care for people like family. That's why at Mon Health you can feel the difference. Once again, welcome to this edition of Mon Health Talk.
Mon Health Talk for this Monday, 104.5 FM, 1440 AM, WHAR. Thanks for joining us. I'm Kyle Wigg, sitting in for Dave Wilson. And our guest this morning is Dr. Ahmad Cheema of the Mon Health Cancer Center. And Dr. Cheema, good morning. Thanks for coming on.
Good morning. It's a pleasure to be here.
Let's get a little bit on your background. You're new to the Mon Health system, correct?
Yes.
Okay. How long have you been with the group?
I started in July, so almost about 1.5 months now.
All right. So you're brand new.
Oh, yes.
Brand new. All right. Where are you from? What's your background, and what drew you to the Mon Health system?
All right. So I'm originally from Pakistan, but I grew up in the Middle East. Then I went to Pakistan for my med school. After that, I came to the U.S. And completed my internal medicine residency at Mount Sinai St. Luke's Roosevelt in New York City. Then I came to Morgantown for my fellowship in hematology oncology at WVU, which I completed this year. So what drove me to Mon Health was that during my fellowship, I realized that I like managing all kinds of cancers and blood disorders. And you actually get that opportunity at community cancer centers like at Mon. So when I researched about Mon, I learned that patients from throughout the region come to Mon for their needs and receive excellent personalized patient and family-centered care. Mm-hmm. As Mon has the leading-edge technology and all the tools necessary for providing excellent cancer care and improving patient outcomes. I believe Mon Health was a perfect fit for my career goals.
Mm-hmm. Well, your introduction to the United States was New York City, which is the largest city in the country and one of the largest in the world. And now you're in Morgantown. That's quite a contrast. How have you adapted to that, and what are the benefits in your mind of being in a smaller community with a smaller community-based hospital system?
Right. Yeah, New York was pretty busy, and I think at that time I was a bachelor, was not married, and it was easy to live in a big city. But this transition to Morgantown has been great. I have 3 kids now. I have a wife who's also a physician, and we really adjusted pretty well to this small town. We actually love it here, and I think it's a very good town to raise family. We love the school system, and if I talk about the community hospital, I think it's a very good hospital. I've loved my time here since I've started. The staff is extremely nice. It's a very collegial environment.
Okay, and your specialty is cancer care. So let's get into that a little bit. What are the most common cancer types in West Virginia? What do you find yourself screening the most for?
Most common cancers in West Virginia are breast, prostate, lung, and colon cancers, which is actually the case nationwide as well. But we do see a decent number of bladder and kidney cancers as well as gynecological cancers, which is actually more than the national average. So usually the screening mostly is for these most common cancers like breast, prostate, lung, and colon.
Okay. Now, fortunately, those are cancers that can be identified early, correct, with screening. There are breast exams. Of course, prostate with the PSA is crucial for men of a certain age. Colon cancer with there's screenings for that. How important is that for people to just kind of keep an eye on things and obviously go through these processes of being screened for these cancers?
Well, I think that's extremely important. Like if you talk about breast cancer, there's a there's a report from American Cancer Society which tells us that, women have about a 1 in 8% chance of developing breast cancer within their lifetime. So these annual mammograms are so important that they can detect breast cancer early, even before you can feel it as a lump. And when you catch it early, the treatment is the easiest, as opposed to when it has already spread to other parts of the body. So I think that the screenings are really important. And same goes for colon cancer, like, colonoscopy at age 45 or 50 has actually led to early diagnosis and treatment and, improving outcomes. And nowadays we have screening for lung cancer as well, with a CAT kind of test for people who are at high risk of lung cancer. So I can't really stress enough on the importance of the screening.
Mm-hmm. And prostate cancer, is that still the top cancer among men, or I would imagine it's one or two? And with the prostate cancer, it's a simple blood test, right? The PSA that can alert you to early symptoms of prostate cancer.
That's absolutely right. If you have symptoms, like if you have change in your urinary habits, like if you're having more frequent urination, if you're seeing blood in urine, that's when you should get checked out. And, a simple test PSA can point to the direction of prostate cancer and, can alert the doctor.
As we speak in generalities here, what can people do to try to prevent these things? Obviously, smoking is probably the number one thing, and we talk about that with just about every doctor on this program. If you're a smoker or even a user of the smokeless tobaccos, stop it, right? I mean, the moment you stop smoking, the risk of cancer decreases.
Yes, you're absolutely right. As you said, if you're smoking, just quit it. And even if you're using smokeless tobacco, that's a reason for a lot of cancers of the mouth and voice box. So, get rid of it. Other things you can do is, like, if you're consuming a lot of alcohol, that has also been linked to a lot of cancer, including esophagus and laryngeal cancers. So my strong advice would be to cut down on your consumption. Eat healthy. Don't consume too much fats or sugars, because now we know from several studies that obesity is linked to several cancers. And, as we discussed earlier, I would emphasize, stay up to date with your age-appropriate cancer screenings. Talk to your doctor.
Mm-hmm. And September is approaching, and September is Prostate Cancer Awareness Month. Now, there's an event coming up, correct? The Zero Prostate Cancer Walk Run. Can you talk about that a little bit, what that is about, and the details there?
Sure. So I think it's happening on August 26th at the Mylan Park.
Okay.
It's about the prostate cancer, and just to increase awareness among people. And I think there'll also be some fundraising for people who are dealing with prostate cancers.
Okay, so that's coming up this Saturday, August the 26th, and you mentioned the Mylan Park Track Complex. I believe it's in the morning. I think 9 a.m. is when it starts.
Yes, 9 a.m., Mylan Park Track Complex.
Okay, so the Zero Prostate Cancer Walk/Run. If you're a prostate cancer survivor, if you know somebody who's been touched by that disease, or if you just want to come out and help them raise funds, that's a good idea there. The Zero Prostate Cancer Walk/Run, again at Mylan Park, coming up this Saturday, August 26th at 9 a.m. So you may be interested in visiting that and again, helping raise funds for prostate cancer treatment and awareness. This is Mon Health Talk Radio, and we're joined by Dr. Ahmad Cheema of the Mon Health Cancer Center. We're going to take a quick break, and we will continue the conversation on Mon Health Talk on WAJR coming up after this.
Now back to Mon Health Talk, a discussion of the issues, people, and procedures in healthcare today. If you have a question for one of our healthcare guests, call now at 304-296-0041.
Mon Health Talk for this Monday. Thanks for joining us on WAJR. Our guest, Dr. Ahmad Cheema from the Mon Health Cancer Center. The first segment, we capped it off there by talking about the Zero Prostate Cancer Walk Run coming up at Milan Park this Saturday at 9 a.m., the Milan Park Track Complex. And Dr. Cheema, from a women's perspective this fall, October to be exact, that's Breast Cancer Awareness Month. Let's talk a bit about the importance of the mammogram and other preventive measures for women to detect breast cancer.
Right, yeah. So mammograms, annual mammograms, extremely important. We know from studies that this is a very useful tool to detect breast cancer early. And, you can treat it early and reduce the risk of dying from breast cancer. So this is a very powerful tool. And I would highly encourage all women above age 40 to get their annual mammograms done. The other thing they can do is like a self-breast examination or a clinical breast examination by their physician. And if they feel a lump or any abnormality, if they have any skin changes around their breast, including like discoloration or dimpling or abnormal bleeding, they should really get it checked out.
Mm-hmm. And you mentioned the mammograms. Does Mon Health offer the 3D mammograms?
Absolutely. Patients should visit monhealth.com/mammogram to schedule their mammogram today.
Okay. And with the 3D mammograms, obviously that technology has improved greatly just in recent years. How does that help? How does the 3D look at it help detect cancers and prevent cancers?
Yeah, the technology has really advanced the past couple of years. 3D mammograms just give you a better look at the breast tissue. It's better than the 2D mammogram that we had in the past. So it's just a better technology to detect abnormalities in the breast.
Mm-hmm. All right. Cancer is a frightening word for many. And when patients hear that word, obviously you run the gamut of emotions. What type of services does Mon Health provide to help people get through this? Now, obviously, every case is different. Some people's situations are much worse than others, but let's talk about from the start when a patient is diagnosed with cancer. What is that like in terms of walking a patient through the steps of getting the care that they need?
Right. It's as you say, it's a difficult time for the patient and the family. I can talk about from a personal standpoint when my dad had lymphoma when I was very young, and that's what drove me to oncology. I think it's just a very difficult time, and Mon Health has done a great job in getting all this support staff that really supports the patients very well through this difficult journey. We have palliative care, we have supportive care, we have pain medicine specialists, and all the ancillary support staff to help patients go through this journey of their treatment.
Yeah, and again, the earlier you detect the cancer, the better of chances are for a survival. And obviously, if you catch cancer before it spreads, that's crucial. So again, these screenings are very important. So again, blood work, mammograms, all of these things. Patients, again, just kind of be proactive, get out in front of it. That would be your advice, right?
Absolutely. And especially if you have somebody in the family who has cancer, it should be very proactive about the screenings, especially breast cancer and colon cancer, which run in the families. So, I would strongly encourage people to, don't ignore it. Talk to your doctor for these age-appropriate cancer screenings that we have the guidelines for.
Mm-hmm. And if it comes to surgery, if it comes to a case where someone needs surgery for prostate cancer or for breast cancer, again, I know the technologies have advanced. It's incredible with how much less invasive a lot of these surgeries are with the robotic procedures and with laparoscopic procedures. Just talk about that a little bit. How much, again, how much that technology has increased and improved just in the last few years.
Yes, I mean, you're totally right. The technology is really advanced. You have laparoscopic surgeries now, robotic-assisted surgeries now, where the incisions are really, really very small. So they heal very well. They heal quickly. You don't have to stay in the hospital for a long time for recovery. I mean, the outcomes are better. The infection risk is lower when you have a smaller incision. I think it's really, it's a fascinating time in medicine, how all this technology is advanced and how we're seeing patients are doing well with surgeries.
Mm-hmm. And recovery times cut down significantly.
Absolutely.
Mm-hmm. All right.
No, really, a lot of these procedures are done in the outpatient setting,
Yeah, exactly. Dr. Ahmad Cheema, Mon Health Cancer Center. We've got about a minute left. And Dr. Cheema, just generally, what advice would you give people to, A, try to avoid cancer, try to stay healthy, and B, again, those screenings for the most prevalent cancers are extremely important. What's your advice to people? And B, how can they reach you? How can they reach Mon Health Cancer Center to maybe set up an appointment?
Sure. So my strong advice again, and it would be a summary of whatever I said earlier, is to quit smoking, cut down your alcohol consumption, eat healthy, and talk to your doctor about your age-appropriate cancer screening. And if you have any unusual or persistent symptoms, don't just sit on them. Go get checked out, especially if you have a breast lump or any skin changes there. If you have blood in your stool, if you have blood in your urine, if you're losing weight when you're not trying to. So these are all the symptoms that you really should get checked out by a physician. And in terms of reaching out to me, people can visit monhealth.com/cancer, and they'll get all the details over there.
Very good. Great information today. And again, we remind folks about the Zero Prostate Cancer Walk Run that's coming up this weekend, Saturday at Milan Park. And that begins at 9 a.m. And I'm sure folks can just Google that, the Morgantown Zero Prostate Cancer Walk Run, in terms of registering for that or getting more information on that. And we hope to see you all out at Milan Park. And again, a fundraiser for patients that are dealing with prostate cancer, and obviously a fundraiser there for cancer research as well. Dr. Ahmad Cheema has been our guest on this Monday morning, Mon Health Talk Radio. And Dr. Cheema, welcome to Morgantown. Welcome to West Virginia, and we certainly appreciate your time this morning.
Thank you. Thank you for having me.
Dr. Ahmad Cheema from Mon Health Cancer Center. And that's Mon Health Talk Radio for this Monday. Thanks for listening on WAJR.